right, good evening, everyone. This is Dr. Brett Haake. I'm here with my wife, Dr. Felice Haake.
Hello.
And our new addition to the Ikaria Concierge Functional Medicine team, Dr. Fromang. Of course, we're live from Ikaria Concierge Functional Medicine in Vero Beach, Florida, and we're really excited about our episode today because we get to introduce the newest member of our team, Dr. Fromang. And he's a little bit about Dr. Fromang. He's a former college football player, played college football at Sewanee University in Tennessee. He's an emergency room physician, but he's also has a board certification in osteopathic principles and practices. So Graves, welcome to the show. Welcome to the practice. I guess the first question that I would like to ask you is, you're from Vero, but you've got deep roots. You've got deep roots in Vero, so tell us a little bit about yourself.
Yeah, no, I appreciate that, Brett. Yeah, born and raised here in Vero Beach. Like you mentioned, family with deep roots in Vero Beach. My grandfather was born here in 1926. My great-grandparents came down from Virginia in the early 20s. Citrus family on my mom's side, and my father's family actually came down from Indiana. My grandfather was a physician in the Navy, and then moving from Melbourne down to here in Vero Beach became one of the early primary care general practice physicians in the area. And then, growing up, my uncle was a urologist in Fort Pierce, Florida for over 30 years. And so there are physicians in the family on my father's side. And so that kind of what piqued my interest in high school and going into college. And then, as you mentioned, alluded to, yes, sports in high school, sports in college at the University of the South at Sewanee, Tennessee. And then slowly spent a year after college, after my mom passed away from breast cancer, just kind of deciding if medicine was really what I wanted to do. And then matriculated down to Nova Southeastern in Fort Lauderdale, where I spent those 4 years and an extra year, like you mentioned, of osteopathic principles and practice, doing a fellowship year in between the second and third year of medical school that Nova offers, which actually works out great because you pay for the first 2 years, and if you do get into that fellowship, they pay for the last 3 years. So
really?
Monetarily.
I never realized that.
Monetarily,
and we all went to Nova. We all went to the same school.
Felice and I didn't get the memo, man.
Yeah.
The memo on that one. So, it does add an extra year. I mean, it does make that 4-year-long journey into 5.
Oh my God, I'm still paying my loans. That's amazing.
So it did work out there, but it was, in terms of, it's one of the best years. I mean, when you rotate through sports medicine there at Nova with neurology, and then the bulk of your time is doing the hands-on osteopathic manipulative therapy that we're all taught as osteopaths, but a lot of that art is lost in, as you allude to sometimes, is in the conventional medicine because of what the conventional medicine dictates, which is moving patients through a system very quickly. And so learning patients' bodies, really getting to know them intimately with the art of touch, it just doesn't allow physicians to move quickly. It's not a fast process.
Yeah.
And so spent the year doing that, and during my third and fourth year, kind of thought I was going to do something with the osteopathic manipulative medicine. My wife's an acupuncturist, thought we would combine, but like they say, if you tell God you want to make God laugh, tell him your plans, right?
Yeah. So you had kids.
Right. So exactly. Children. Matched to the University of Miami at my wife's telling me not to put Miami on my rank list in physical medicine rehab, only to get emergency medicine March of my 4th year. And it just so happened that my best friend growing up here in Vero Beach, Dr. Hamid Husseini, was at the University of Mississippi in emergency medicine. He's like, man, you need to come up to a rotation, which I did, and then did my internship, reapply. That's how I've been on this emergency medicine journey for the past 15 years.
Yeah.
Caught up in the conventional side of move them through as quickly as possible, treat them and street them or admit them. And so as I can see, I'm in my scrubs coming
and
in
the Crocs.
And the Crocs.
Very
That's
ER.
right.
Very ER.
Coming in from a shift tonight.
It's not even a Halloween costume.
That's right.
It's a real
Coming in from a shift tonight. But having now wanting to slow down, right? And so for me, over the past 2 years, having gone part-time in the emergency room, I have really started to take a look back on like what's important. And for me, it's been time with family, time with being able to coach my son's middle school football teams, and basketball teams, my oldest daughter getting ready to go to college, like really spending that quality time that I missed out with my mom around my same age. I'm 44, she died at 47. So putting into that perspective, then realizing, all right, what do I have to offer? Emergency medicine isn't, it's a fast-paced thing. It's acute care. Do I really want to work in an urgent care style type of practice? Well, I see that every day in the emergency room, right? Because where do patients go without access and they need communication? Well, they come to the emergency room, right? 90% of what I do is not emergency medicine. It's access and communication medicine. Can you explain my blood work? Can you go over these tests with me? Can you help me, take care of this problem I've had for 6 months because I can't get into my doctor? And so I wanted to get out of that, type of practice and really go back to what I trained doing back in med school, which is getting back to doing, not only doing with concierge, but also adding that extra layer of osteopathic manipulative therapy. So,
so many things to unpack. In our first episode, Felice and I talked about why we got involved in the functional medicine piece. And Felice is kind of a natural transition coming from family practice and medical bariatrics. I'm a cardiac anesthesiologist by convention, but I think you bring up a lot of things to really unpack. Not that this episode is really about the economics of medicine, but one of the issues is folks using the emergency room as their primary care area to receive primary care, and then just getting access to a physician to go over things. And one of the frustrations I think that you have, and a lot of us have in the conventional realm, is that you spend 30 seconds with a patient and then somebody's on your back to go see the next patient, and you have to see a certain amount of patients every shift or whatever to maintain, economic viability. And it's really kind of an insane situation if you actually start to sit back and think about it. And so that really kind of boils down, it really kind of explains why we exist at Ikaria Concierge and Functional Medicine. And we're so happy that you're part of the team because we have an emergency room physician who's boarded in osteopathic principles and practices combined with the other physicians that we have in the group. And so talk to us a little bit about osteopathic principles and practices. And then if I come in as a patient, what can I expect from somebody who is well-versed and fluent in osteopathic medicine?
Before you answer it, I want to say one thing.
Yeah.
Many patients, and I don't even know if you know this, will go seeking a DO, which is what we all are, doctors of osteopathy, because of this, because they want this practice. And unfortunately, what they don't realize is that if you don't use it, you lose it. It is like a language. And so we were trained in it, but we didn't continue the practice. And so we lost it. I can't tell you how many patients have walked in and said, "You're a DO. I want you to do this, OPP on me." And I'm like, I don't remember how to do it. So it's really important you do, in my opinion, you have someone like trained like Graves, so
absolutely.
I just want to just point that out.
If I am a 47-year-old athlete, and I've got the, aches and pains, maybe a little back pain, maybe a little bit of knee pain, et cetera, and I go to it, how are you going to evaluate? Let's say I come into your clinic. How are you going to evaluate me, and what can I expect?
Right. And so just like anything in medicine, we always start, with the history, right? We've got to get boiled down to what did you have trauma? Was there a fall? Was there something, going on in your, in terms of your childhood? Was there surgery? Was there different things? So you get a good history, right? You get a good base. What is it that's bothering you? And then from a purely osteopathic OMT perspective, we're looking at structure and function, right? What is the musculoskeletal system is one of the largest systems of our body, right? One of our largest organ systems. And so structurally, how is the body mechanically working right now? And functionally, how is that? How are they all working together? Personally, I always start, and I always talk to my students and stuff, like always look at patient's gait, right? So I always start with watching patients walk. How is their gait affecting their ankles? What I mean by gait is how they're walking. How are their feet aligned? How are their ankles, their knees, their hips, their back, right? It all translates. The body you're never going to see people walking like this unless they're just functionally, structurally have to. Like the body's always going to keep you upright. Do they have a scoliosis? Do they have an S-curve? Is there something else going on, right? So always start looking at them from a broad scope of structural. And then we start to work at looking at ranges of motion, right? How far can we move those joints? What are the barriers to those ranges of motion? And then from there, it's getting a good feel of the body, the tissues of the body. We talk about TART in OMT. What does that stand for? It's tissue texture. So is it real tight? Is it real soft? Is it pliable? Asymmetry is one shoulder high, one shoulder low. Is one leg, what they call leg length discrepancy. Restrictions, right? We're talking about the ranges of motion, the different barriers, and then tenderness. What's painful, what hurts, right? So we go through this kind of like algorithm of that, what they call the TART acronym. And then from there, personally, I'm always looking at the core of, not along with their gait, then we're looking at their pelvis, their sacrum, and we're working up the spine and different things. Seeing if, well, maybe your back pain really isn't your low back. Maybe your back pain is a muscle in your hip, or maybe it's your sacrum that's locked up, or maybe it's your neck or something like that. So, it's putting the pieces together. It takes time.
Yeah.
That takes time. That's not, like I come from the ER today. My belly hurts right there, and it only hurts right there. All right, listen around, nothing else is going on. Boom, it's probably your appendix because it hurts right there. But when we're trying to put these pieces together in terms of you coming in with certain aches and pains and things, right? We're building a mental note of how the whole the system is fitting together. Again, like I said, that takes time. So an initial visit, that's probably going to take 45 minutes to an hour.
Right.
As we get to, know your body, right?
And it's a very whole person approach, clearly.
It's a whole person approach, right? It go from medical history to surgical history to all different aspects. We're slowly building, and then the art of touch comes a huge part of that.
Right, and I think you hit on a lot of different things that we can unpack, but I think the key piece here is that if you have anatomic symmetry and you have less restriction to motion, then the body essentially, blood can get to certain areas, inflammatory tissue can drain, and that's obviously a big part of achieving health and wellness, and really fits in beautifully into the entire prevention and functionality approach that defines, what we're trying to do. So that's, and I think it's important to understand that when you come in, it's not a rushed visit. You're gonna work with patients for 30 minutes. Mm-hmm. Sometimes even 45 minutes, and it's a whole body approach to the patient.
Can I ask, how would you answer somebody, because this has come up a few times, who asks, is this like chiropractic medicine? And this is not to discount chiropractic medicine. How would you answer it?
So, I sometimes I explain to patients, I ask them, have you had chiropractic adjustments? Because part of what we do, there are some, for lack of a better way to describe it, the whack and the crack, right? Manipulating it so you hear the popping sound, so to speak, that, a lot of times, yes, we do get relief, right? Because there is certain rotations and certain ways that the spinal column adjusts that, you hear that pop, you get that release, and you do have, vertebrae move or twist or go back into alignment. Right. But on top of that, and I don't know all about how chiropractors are trained, but I can tell you how we're trained. There's different ways to manipulate. If somebody, like majority of our patients that we see in our clinic are elderly, right? They are in their late 60s. They're in their mid 70s. Their spine's probably not going to tolerate that whack and crack, right? They have osteoporosis. They have osteopenia. They may already have spinal small little vertebral fractures in their spinal column. They can't tolerate that, right? But there are different modalities. So things like what we call muscle energy, which is like bring them to the barrier where right before you would do what they call a high velocity, low amplitude thrust, where that cracking that you hear, but then you have them push away off that barrier, and you go through different things to try and manipulate or move the different vertebrae or loosen the muscles around different areas. There's massage. Okay, there's things called functional position release, where you actually put it into a position of ease and allow those tissues to relax around that area so that it can realign itself. So there's multiple modalities to the way we practice or even approach patients, because not one body's the same. We're not airplanes. Medicine likes to always talk about the body being an airplane. We're not.
Right.
Everybody's unique. Everybody's different.
It's biology.
It's why it's such an art, and then you can have what you think are all the right answers, and certain patients, don't want to do certain things, or they want to try certain things. So it really is an art as much or even more than it is a science. And so this brings us into our next thing. So we have our functional medicine clinic downstairs, and that's where we're all seeing patients, and we're doing our cardio IQ cholesterol panels, measuring metabolic health, looking at hormones, looking at all your vitamins, looking at your conventional labs, and really putting together health optimization plans. Of course, we do a lot of direct access primary care, so that's our bread and butter. But upstairs, we have our longevity center. And so upstairs, you've got your room where you're doing osteopathic medicine, and you're doing the evaluations that you just described. So what else are we doing up there? What are some other offerings that we have?
Vitamin IV therapy.
Okay.
So we have an IV room. We have a red bed, biomodulation, which we can talk on. And then some new toys. We have one up there that we're testing out called an intermittent hypoxia therapy machine.
Correct.
Super cool.
Yep.
And then we're looking at bringing in
cryotherapy.
Right.
So, right. And so this is all part of our longevity center. One of the, we mentioned Avron Blooming, I think, in our last podcast. There are some other doctors that I think have really done a great job as far as understanding hormones and those kinds of things. But one of the guys that I talk to patients a lot about is a guy by the name of Thomas Seyfried, who is a biochemist and a geneticist out of Boston College. And his work has been on understanding cancer as a metabolic disease. And really, when he says metabolic disease, a mitochondrial disease. And you and I, we can all talk about how metabolic dysfunction, or what we call insulin resistance, is related to mitochondrial dysfunction. But
can you back up and just give a brief description of what mitochondria are?
Mitochondria are little apparatuses that exist in everyone's cells. They have lots of them, and their sole job is to make what's called ATP. ATP is the energy currency of the body. So these mitochondria go around the entire cell, and they deliver ATP to different aspects of the cell so that the cell can function. So the more efficient and functional the mitochondria are, the healthier the person is. The more deficient and dysfunctional the mitochondria are, the more unhealthy the person. There's a direct link between what we're talking about with insulin resistance, how we say that insulin resistance is upstream from probably the majority of non-communicable diseases in the United States, but there's a direct link between insulin resistance and mitochondrial dysfunction. So one of the things that I've always been curious about within the medical realm and the functional medicine realm is, how do we treat mitochondrial dysfunction? But then if we're treating mitochondrial dysfunction, how do we measure the dysfunction to begin with, and then how do we measure the intervention? And so we've talked about our Vibrant Lab offerings. We've talked about our Health Span Assessment Panel. We've talked about the Oxidative Stress Panel. So now what we have are these basically longevity devices that really, you could really think of them as a mitochondrial stack. And so we have what's called red bed, which is the scientific word is photobiomodulation therapy. And if you go to PubMed, which is really the world repository on health information and studies throughout the world by various countries, various doctors, various scientists, there are over 10,500 studies on photobiomodulation therapy. The overwhelming majority of the studies show two things. Number one, that what they're measuring, the intervention is effective, and number two, it's safe.
Yeah.
And so we have a medical grade photobiomodulation therapy, and what it affects is it allows oxygen that we breathe in to take its correct place at what we call complex 4 of the mitochondria. So in theory, the way it works is it moves bad molecules, specifically what we call oxidized nitric oxide, out of the way of complex 4 and allows oxygen to take its place. What's neat about the red bed is we couple that with what's called intermittent hypoxia therapy, which is a therapy that's been of recently used in Germany and Switzerland and Austria in functional medicine clinics and various healthcare clinics in that
Even
part of the world.
conventional clinics in Germany are
Conventional
using it.
clinics. And it was a therapy that was originally designed by Russian scientists to help with Soviet athletes in the 1960s. And
They were cheating. I'm just kidding.
Well, yeah, that's a whole nother podcast right there. But the thinking behind it is you expose the patient to very brief episodes of the atmospheric oxygen is 21% oxygen. So you expose the patient to very brief episodes, 5-minute episodes of about 10% oxygen. We call that hypoxia. So brief episodes of hypoxia followed by 3 minutes of what we call hyperoxia. So higher than 21%.
Which is below sea
oxygen.
level, essentially.
Correct.
Yeah.
And so you do several cycles of those, and what it does is it gets the body, it exposes the mitochondria to what are called reactive oxidative species, and then the body responds by an increase in antioxidants, specifically an antioxidant called superoxide dismutase, and then the glutathione family of antioxidants. And so it affects the mitochondria in a different way, but a good way, than the photobiomodulation therapy. And then you go down to the cryo machine, and it's basically like cold plunge, very similar. And what that does is it stimulates something called mitochondrial uncoupling protein. And so it's the same thing that you have when you do a cold plunge.
It's like exercise.
And the uncoupling protein, essentially what that does is it forces without going into too much detail, it forces what's called the electron transport chain, which is essentially the engine of the mitochondria. It's how the mitochondria makes ATP, and it basically forces the electron transport chain to work harder. And
you can pair all of these things
we can
together.
pair all these things together, and you and I have actually done a couple of these things preliminary. I know Dr. Fromang's done them as well. Graves has done them as well. And maybe it's placebo, but you really feel like you're an 8-year-old again with the clean energy that you get, with the ability to think clearly. Things start to feel better. Seems like you sleep much more effectively.
Yeah.
One interesting thing about photobiomodulation therapy is that patients will experience a Jerish-Hersheimer, can experience a very mild,
First time
it's
I
called
had that.
Jerish-Hersheimer reaction, which is, it basically essentially tells you that the body had some inflammation, and that inflammation is starting to get better.
It's detoxing.
Detoxification.
You know what I found with these patients has been a great formula is my patients are coming in, we're doing a 30, 45 minute, hour-long session of osteopathic manipulative therapy, and these patients are then jumping right into the red bed.
Amazing, right?
And I'm telling you, the look on their face when they come out is just one of pure relaxation.
Yeah.
Just a lot of stuff is melted away between those two sessions, whether it's 10 minutes or 15 minutes plus the OMT. Like this formula, I don't know if it's anywhere in the literature, but it probably isn't.
Should be.
I'm just telling you, like patients are reacting and just walking out of here on cloud
great.
nine,
Feeling
amazing.
It makes sense because in theory, what you're doing is optimizing blood flow to parts of the body that potentially haven't gotten blood flow. And what you're really doing with blood flow is delivering oxygen to the tissues and essentially oxygen to the cells. And then what red bed's doing is it's pushing the bad nitric oxide out of the way of what we call complex 4 and allowing oxygen to take its rightful place into that location. The neat thing about photobiomodulation therapy as well is if you also pair it with what's called methylene blue, which is gaining a lot of traction, a lot of interest amongst functional medicine clinics, amongst athletes, amongst people that are interested in performance medicine, because methylene blue acts like an electron transport chain catalyst at complex 2. So you pair that with photobiomodulation therapy, with somebody that's well-versed in manipulative medicine, with the cryotherapy and with the intermittent hypoxia therapy. And now we're moving from the realm of conventional healthcare, which, let's be honest, it's almost a sick care model, to not just healthcare, not just prevention and functionality, but human performance.
Right.
And I think that's what we're interested in. And this is one of the things that when we all sit down with patients and we talk to a teacher, for instance, if we can make a teacher better, okay, how many people are we really affecting? How many people here all remember their favorite teacher,
right,
and how they affected their life? I can say right now, I got a couple of them. Sister Lois in 6th grade, Mrs. Whitnauer in 4th grade. I'll say right now, my 4th grade teacher, it was harder probably than any of my medical school years, right? So teachers, engineers, architects, police officers,
fellow physicians,
fellow nurses. The bottom line is we should all be treating ourselves like professional athletes. It doesn't matter who you are, that we should seek to make you better at work, better at home, in the moment, better with your kids, better with your family. And really that's what we're doing. These are our offerings, and that is our sole objective. You know, it's interesting. I had a friend of mine today ask me, why are you doing what you're doing? And he says, why are you doing this? And I said, honestly, my answer is I want to build a Rolls Royce.
Yeah.
I really want to build a Rolls Royce. And so I think that our downstairs clinic, this is what we've been doing for a while. We're so happy that Dr. Fromang, Dr. Graves is with us as part of our offerings in our downstairs clinic, but enhancing what we're doing upstairs with his manipulative medicine. So we're so excited to be here. We're excited about the future of medicine. We have a lot of challenges in the conventional system in the United States, but what that means is we have a lot of opportunity. So we're super excited. We invite everybody to come check us out. And
the people who can, obviously speaking to a national audience. So I would say to people who are looking for these things, look them up. I mean, there's other doctors out there like us. Obviously, you're in Washington State. You're not most likely coming to Vero Beach to see us. But there are other doctors doing this. A4M is a great place to look. IFM is another great place to look for doctors that are like-minded. And I can tell you from my own experience with some of the devices we have upstairs, I mean, and I didn't even get to do the OMT, which I'm sure I've had tremendous amount of patients come to me and say, he's a miracle worker. Like, my shoulder pain's gone. So, but the red bed, I had shoulder pain for months and months and months with no relief, and got in the red bed for 6 weeks, 2 to 3 times a week. Gone. And I actually learned about it from other patients prior to us getting one. There were just so many, and these are anecdotal stories, but they're real.
Well,
so
if I mentioned before that we have there are over 10,500 studies in PubMed regarding photobiomodulation therapy. There are studies on insulin resistance, hormonal optimization, chronic pain, fibromyalgia, depression, bipolar, anything you can think of, and the overwhelming majority of the studies show benefit. Mm-hmm. I can't think of a single study that has shown that it enhances risk. And so you start getting into this whole unified theory of disease. And I think, the guy that I mentioned before is Thomas Seyfried. He lectures, and he wrote a book, basically essentially a collection of his lectures and talks, and it's called Cancer as a Metabolic Disease. And so his thought is that he added to the work of a German scientist by the name of Warburg, who basically, without any knowledge of the mitochondria, without knowledge of an electron microscope, without knowledge of DNA, showed that cancer essentially converts sugar into lactate, and that's how it makes energy. And so what Thomas Seyfried has been able to show over and over again is he takes the mitochondria from a cancer cell that's very, very dysfunctional and puts it into a normal cell, and that normal cell will develop cancer. Then he takes the DNA from a cancer cell and puts it into a normal cell with normal functioning mitochondria, and the cell stays normal. So his whole thought is cancer is actually a metabolic disease, the disease of the mitochondria.
So fascinating.
And so this gets into this idea that we should really be seeking to upregulate and enhance mitochondrial function. And so the upstairs, the Vibrant Lab offerings gives us the ability to measure, and then the upstairs gives us the ability to provide great interventions for our patients, and then we can remeasure those interventions with our Vibrant Labs.
Yeah.
All paired with Dr. Fromang's expertise in manipulative medicine.
And I want to say you kind of touched on the kind of physiology behind the IHT, the intermittent hypoxia therapy. But then, I've been listening to some information regarding pairing it with music. So music, IHT with red bed, and how it's helping with psychiatric disorders, with depression, anxiety, significantly addiction. They're using it for addiction because what they're seeing is an actual brain chemistry change where there's perception change. People are perceiving things differently. Something that would typically upset them and get them wired and all fired up is not. So there's also a whole nother, application to it. So we'll definitely pair it with music, I think, too, as well.
Absolutely exciting. Like we said, we welcome the changes being brought by Marty McCary with regard to removing the black box label with estrogen. We're excited.
Amen.
We recognize that there are a lot of challenges within our system, but we're also excited about the opportunity that I think these challenges present. So if you have any questions, please call us. We're Ikaria, Ikaria Concierge and Functional Medicine, and we're at 5089 A1A. And like Felice said, if you have interest and you're from a different state, there's the American Association of Anti-Aging Medicine, the A4M, and there are a lot of good functional medicine doctors that are out there. So thank you for listening. We look forward to our next broadcast. Thank you so much, guys. Appreciate it.
Thank you so much.
Thank you.
Thank you.